1230 Kxo, El Centro, California. And as we have been doing for 3, 4, 5, 6, 8 months, who's counting? We're getting an update on the COVID-19 situation in Imperial County. And today, with us by telephone, socially distancing, Karla Lopez with the Imperial County Public Health Department. Karla is an epidemiologist. And, okay, Karla, good morning. You there, Karla? Okay, are you there, Karla?
I'm here.
Okay, let's see. You are an epidemiologist, right?
That is correct.
What is an epidemiologist?
It's public health staff that work in the area of public health where we do surveillance for any kind of disease, but in particular, here in the health department, what I do, I monitor infectious diseases.
Okay, and of course, right now, the number one is the coronavirus or the COVID-19, and you're heavily involved in that and pretty much have been from the beginning, right?
Yes, that is correct.
Okay, and one of the things that has popped up is contact tracing, and we need to know, what is that?
Yes, so contact tracing is a tool that is used by public health staff to prevent the spread of infectious diseases. So right now, in regards to COVID-19, we are doing contact tracing that involves identifying the people who have the infectious disease, COVID-19, and trying to gather information of who they have been in contact with during their infectious period. So that way, our contact tracers can reach out to those close contacts and give them a call and let them know that they have been exposed to a COVID-19 case.
Okay, and now this all takes some time, and going back to Sam Spade or even Magnum, there is a little bit of investigation that goes into it, right?
That is correct. So once we receive a lab-confirmed COVID-19 case, our case investigators will give them a call. We do collect some information. We do have a case investigation form that needs to be completed, where we collect, demographics. We ask them about what symptoms they had, if they have any underlying conditions. And then towards the end, we do collect information, as we mentioned before, of those who haven't been in close contact with this person. All the information we collect is confidential. We do not share that with no one. Of course, that's for our in-house analysis of our cases. And once we have that contact information, both for household contacts and non-household contacts, we forward that information to other public health staff, which is our contact tracers. They will then reach out to these close contacts and let them know the possible exposure without revealing the information or the identity of the original patient.
Okay, and some of the questions you might ask is, were you at a party? Or who lives in the same house, right?
Yes, so for the household contacts, it would be everyone who's under that same roof, under that same house. The families, spouse, maybe siblings or, grandparents or whatnot. But once we reach out to our non-household contacts, that would be any people who came to visit that household, anybody, neighbors, co-workers, if they attended any party, anything like that. So any person who was in close contact with that confirmed case within their infectious period, we help them kind of recall and gather as much information on those contacts, and that would be name, a phone number where they could be reached at, so that way our contact tracers can reach out to them.
Okay, now, obviously this is important, right? Because, somebody needs to know, I have been in close contact with somebody that tested positive. I better get tested, right?
That is correct. It's key for us to for us to stop the spread of COVID-19 within our community. And we really need the help and the collaboration of our cases when we're investigating. Sometimes, there is some, sometimes they feel uncomfortable providing that information, but it's really important for us to be able to have that, so that way we could reach out to those close contacts and let them know of their exposure to a confirmed case, what they need to look out for the next 14 days, because those close contacts should be in quarantine, which means that from their last date of exposure to that confirmed case, they need to be quarantined at home for 14 days. And during those 14 days, that person should be monitoring for signs and symptoms of COVID-19. They should maintain a distance from their household members, within their home, and just keep an eye out, for those signs and symptoms. We do provide them with resources of, where they could go to get tested should they need to get tested, and also what other resource they might need for, such as essential services that they might need. Maybe there's someone that, if they need to get groceries or stuff like that, taken home, we could provide that for them, of course.
Okay, and obviously it is important that any contacts be aware so that, they can lessen their contacts and lessen the chance of continuing the spread of the virus, right?
Yes, that is correct. And one important thing is sometimes we might have some mild symptoms of COVID-19. So it's important, to suspect, that we might have COVID-19. If we have, a mild cough or we're feeling tired, we should take the precautions at that moment to, I'm going to wear my mask, and I'm going to isolate, from my family at home until, I get confirmation of if this is truly due to COVID-19. And I could start doing those preventive measures at home. I do not have to wait until I get a confirmed laboratory test back for COVID-19. We could take those measures at that moment once we start feeling those mild symptoms, and taking those measures to protect our family at home, and if we work, protect our coworkers and so on. Just stay at home, wear your mask.
Okay, now we have seen it, and we will see it again. We are 6 days out from July 4th, and I know you're anticipating a spike. As we had after Easter, after Mother's Day, after Memorial Day. Idiots just don't seem to get the message that it's there and it's being spread. And I know one of the things that has been stressed, okay, I know they're family, but they don't live in the same household. That message has been gotten out. Avoid the social gatherings. You have seen the spikes after the holidays, right?
Yes, that is true. We have seen spikes after certain holidays, and I think what's important for the community to know is we're in this together, and we really, our residents really play an important role in containing the spread of COVID-19. So we do ask, especially, our young people who, feel that, this is not going to affect them, or, and it's true, that not everybody gets sick, not everybody shows signs or symptoms, but we do have to keep in mind that, we have people who have underlying conditions who, at the moment of them being exposed and possibly infected, are at higher risk of having severe symptoms, complications, and even, passing away from COVID-19. So we just have to be mindful of, of ourselves and everybody else, try to keep everybody safe, wear our mask to everyone. If we're stepping out of our home, we should wear our mask to wherever we're going, and avoid those social gatherings at this moment. I know it's hard. We've been in quarantine for, a couple of weeks now, months, but we do have to respect that and try to avoid that until we have this under control, until we stop the spread of COVID-19 within our community.
Okay, and the mask, It's more to protect others from you. And I know what I've heard from several of the younger generation. Hey, I'm young, I'm healthy, I can handle this. You may be able to, but maybe your favorite aunt or your grandmother can't. And you run the risk of infecting them. So.
Yes, and that is the number one reason why you should be wearing your mask. It's not just thinking about ourselves, but thinking of others. And that's the way to do it, and that's the way to show it. Wearing your mask, keeping your social distance, and washing your hands. It's just, it's like I said, this is teamwork. We have to get everybody involved, not just, the health officials and the public health staff. It's the community also. We all have to do our part.
Okay, Karla, did we miss anything?
I believe not. I just want to let everybody know that if you do receive a call from us, from our public health staff that are doing the case investigation, we have terrific staff that are there to support you and help you answer your questions. We would greatly appreciate that you help us out in containing this, stopping the spread of COVID-19 within our community. And the way that you could help us out is by giving us that information on your contact, so that way we could have our contact tracer team reach out to them and provide all those resources that they need for them to take care of themselves and their families.
Okay, and if you provide the information, you could be a lifesaver, somebody that has been exposed.
Yes, that is correct.
Karla, you have a very good weekend doing what everybody else is doing. Absolutely nothing. And it's been a pleasure. And down the road, we will check back with you and see how things are going there.
All righty. Thank you so much.
Okay.
Enjoy your weekend, too.
Yeah, okay. Thank you, Karla Lopez, epidemiologist from the Imperial County Public Health Department, giving us an update on the COVID-19 contact tracing.
The Imperial Valley's best oldies on the radio.
The best music all day.
AM 1230 KXO.